What's up guys, Alex Wallace here from Wallace Training Systems, and this is the second half of the hour-long conversation that Michael Mash and I had regarding barbell training, physical therapy, all that stuff. So if you didn't see the first part, you definitely want to go back and watch that. We talked about common causes of injuries, different mechanics for the squats, a whole bunch of different things that you definitely want to go back and watch. This second part is the actual, I guess, physical therapy session, if you will, where he took me through a couple different exercises, a couple different movements to see how it felt on my hip. So for me, I'm dealing with hip pain and I want to try to eliminate that. Obviously, I have a powerlifting meet coming up September 28th, and I want to make sure that I feel good and I'm as strong as possible when I step onto the platform. So again, if you didn't see part one, I will link it. Let's put it up here. Go back and watch part one. This is part two where we'll keep it raw. This is exactly what I went through to try to remedy my hip pain. And I've implemented a lot of these things into my program already and my hip feels a lot better. So thanks for watching. If you found it informative, don't forget to subscribe, like the video, do all that stuff because we are committed to growing this YouTube channel. So enjoy the content. All right, cool. So basically, like, I went from a high bar position.
Okay.
So grip is a little narrower. Obviously, high bar, bar's high up on my back. My stance width was about here. So I took a narrow stance,
Yep.
and I'd squat fairly deep. I come here, and then up. Honestly, I'm not really feeling any pain right now. Little, even with the bar, like at the very bottom, when I come up, I would say like right in this range, I feel a little bit.
Gotcha.
Nothing crazy. But I went from like that, obviously low bar, I go out wide, bar sits right over my delts. I come out wider here. And my rationale for like the wide stance is I can get my stretch reflex a little bit higher. So getting ready for this powerlifting meet, I don't want to squat too deep because I know I can squat a little bit more if I come just right below. Yeah, see, that's where I'm feeling it.
Gotcha.
If I come to here and then up, like even that, this is an empty ass bar, you know what I mean? Like I can still feel my hip a little bit here.
Gotcha.
So my hips are coming back, I'm sitting into the hole. I don't have to squat as low here. Like for whatever reason, I get more of a stretch reflex right here. I'm feeling tight, like I can fire up.
Gotcha.
Squat. So that's the form modification that I made. Maybe you can throw weights on if you want, you tell me.
Gotcha. So the first thing I would say is the stance width, the change in stance width. Nothing inherently wrong with the narrow high bar or the wider low bar. I think it was just too much of a jump.
Okay.
And that now your body is, we use the word sensitized to this wide stance position.
Okay.
The majority of people that go this wide on the low bar squat are, I think there's a misconception that with the low bar squat that you need to have a really wide stance.
Okay.
And I think it goes to the fact that most people that are doing that equipped, right? They're doing that with a squat suit. So I would recommend moving the stance width inwards. You're still gonna get that stretch reflex, maybe somewhere in between where that high bar and low bar was. Just try a couple reps, maybe bring the stance width in.
Okay.
An inch, let's try like an inch each foot.
Okay. Here. If I'm normally out here for a low bar,
Try right there. Yeah. See if that changes anything.
I mean, I feel it less, to be honest. One thing that I noticed though is like I feel like I'm squatting deeper.
Yeah.
Am I squatting deeper?
A little bit. So why don't you try? So the trick is even if you move the heels in, you can still get those knees out to build that tension on the adductors. So now we move the stance in. So just think about getting the knees out more and see if that limits that extra inch or two of depth.
Yeah, I feel tight here. Now I'm really thinking about turning, like I'm turning my feet out.
Yep.
I'm turning the knees and the feet out pretty hard.
Hip pain, the same, different?
Different. Less. So when I'm super wide, hip pain's in the front, almost here.
Yep.
Whereas that narrower stance here, I don't want to say it's pain, something different here.
Gotcha.
Does that make sense?
Yep. So that's what I would do right off the bat. I would narrow that stance up a little bit, not quite to the point of where the high bar was.
Yeah.
and work on getting those knees out to build that adductor tension. I think you're just taking your hip. So when you're at the really wide stance, you're taking your hip. When you're at the bottom, you're going to be in flexion and a little bit of internal rotation just because of how wide that is. It's so difficult to get that knee way out, and maybe that's just your hip is now sensitized to that position. So we got to get it out of there, and we do that by moving the stance in and getting the knees out a little bit more. The feeling you might be feeling here is just maybe now your glute medius is really turning. I don't want to say turning on. It's just you're focusing on getting the knees out. So now your brain's more aware of that. Does it feel pinchy?
It doesn't. It feels tight, like a ball right here.
Gotcha.
If that makes sense.
Yeah, so that's something that I would temporarily decrease the load a little bit, as much as you don't want to hear that, as much as nobody wants to hear that. And then linearly progress back up with the narrower stance. Let's do something on the ground real quick. Look at your hip. So why don't we come lie down this way, head up there on your back.
On my back. Okay.
So this is how we can sort of get a look at the hip joint itself. So tell me if you get pinchy in the front of the hip here.
Yes.
And then if I go like this, it probably makes it a little worse. Doesn't feel good.
Right.
But if we take it out here, sort of relieves it.
Oh,
So what happens is you were taking it here, but then giving it a little bit of that right there. So that's sensitized, so we got to get out of that. And we get out of that by moving the stance in. So we find that slot, which is usually right around here, and that's where you squat. And we avoid loading in that position or that position. Does that make sense? So, I mean, the diagnosis would be femoral acetabular impingement, or FAI. So the hip's just not tolerating that flexion, internally rotated position. So we just got to temporarily avoid it. That would be that.
Perfect. Is there anything like, let's say, so when this is, maybe it's the same, maybe it's different. Like when I bench volume, when I'm training my bench, my grip is about this much further in than when I'm competing. So I bring my grip out slightly when I'm gonna hit a heavier bench. The reason I do that is because I find that truncated range of motion, I can do a couple percentage more, maybe like 5 more pounds, whatever. But if I train super wide, like a lot of reps super wide, I get shoulder pain, elbow pain, all kinds of stuff. So like, could I, in theory, train narrower and then maybe move out a little bit during competition, or do you think that change in technique would be a detriment to the actual performance day, to the September 28th? I'm trying to squat 600 pounds. Am I better off training and competing in that stance, or training there and just being like, look, dude, my hip's gonna be sore, I'm moving it out?
I would recommend training with the new stance. I think you'd be pleasantly surprised at how strong you can get with that. I mean, I used to be the same way. Like I feel strongest out here because I have all this tension and tightness at the bottom. But my squat, I mean, this is N of 1, and I've worked with people. I think that you'd be pleasantly surprised at how strong you can get with just that. I mean, it was only an inch or two in, and the fact that there won't be pain there to limit your ability to contract hard, and you're not going to be thinking that at the meet, like, okay, like at the last, so you trained with this more medium, moderate stance, and now at the last minute you're going to change. You don't want to be thinking under the bar, I know this is going to hurt, but I'm going to push through it anyways. I'd rather you be, I'm here, I'm comfortable, I'm strong, I know that I'm going to blast through this.
Especially because I still have to bench and deadlift after that. So it makes a lot of sense.
I would move it in permanently.
Okay, cool. Yeah, I'll definitely start with that. I squat again in 2 days, so I'll move my stance in a little bit, hit some volume there. Probably gonna have to back off a little bit, unfortunately, but yeah, that's pretty much. I'll give it a shot and see if anything screwed up. And
for sure,
I got your phone number. So other than that, man, it was super informative for me. I think we touched on a lot of different stuff. I liked it. I selfishly wanted you to come in here so I could also get some squat stuff as well. Other than that, where can we find you? Why don't you tell?
So you can find me on my website, barbellrehab.com. I do both remote consults, and I will be opening up a clinic soon in Pittsburgh where I'm going to be taking people on site.
So perfect. Guys, if you like the video, make sure you like the video. If you found this information informative, then make sure you subscribe to this channel. In addition to that, Mike has a great Instagram. I've been following it for a lot of years. It's Barbell Rehab. Go on Instagram, look at his Instagram, and make sure you also follow that. Other than that, guys, I hope you liked it, and we'll talk to you next time.
Thanks.